nurses that will be with you on the 30th during your cesarean section. What brings you in today?
The other day and talking to the doctor about my delivery and booked my date for my C-section. I'm nervous about having such a big surgery done and felt as though the process wasn't really explained. I'm wondering if a C-section is my only option for delivery, being 40 weeks along. The doctor mentioned induction, but scheduled a C-section, and now I'm having second thoughts. I'm just seeking some clarity on what my options are and the benefits and cons of either option.
Yes, I'd be more than happy to help explain your options to you. Are you more so wondering about the cesarean itself, or are you hoping to learn more about the induction process?
Yes, I'm wondering more so about induction and how the process goes compared to a C-section. I was on the internet looking up induction versus C-section, and I'm confused why the doctor would prefer surgery rather than induction. I have no other health issues, and the baby's not breeching, and he's doing well.
Yeah, so some physicians tend to prefer to do a C-section. However, it's not necessary to have one done in your case if the baby is healthy and there are no health concerns with you. It's just sometimes their preference rather than doing an induction of labor. But at the end of the day, it is your delivery, and if you're more comfortable with an induced labor, we can definitely look into that, talk about your options, as well as consult your physician. Are there any specific questions that you have about an induction of labor, or just the overall process?
Exactly is an induction, and how do they do it?
An induction of labor is typically done when there are health risks to the mother or baby, such as hypertension or fetal growth restriction, placenta previa, gestational diabetes, kind of anything like that. But in your case, it can also be done when you're approaching the 41 or 42 weeks of gestation and labor isn't occurring naturally. So you would be post-term at this time. And leaving the baby in longer than term puts you and the baby both at risk for yourself, and can cause a longer labor. It can cause us to have to use instruments during the birth, so either forceps or vacuum, that kind of thing. It can cause a lot more tearing when delivering, infection or hemorrhaging after birth. And it can also increase your odds to have a cesarean section. The risk for the newborns include placenta problems, decreased amniotic fluid. The baby could stop gaining weight or could even lose weight if he's in or she is in there too long. The baby can breathe in fluid of the first stool and can cause meconium and aspirations, and that's not good for baby's lungs. It can also cause the baby to have low blood sugar because they don't have enough glucose stored. And then obviously worst case scenario, depending on how long the baby's in their post-term, it can cause the baby to be stillborn. However, inductions are actually becoming more and more common, where 1 in 4 women will have to be induced to deliver their baby. So do you have any questions about that before I continue?
Yes. How does the day of induction occur? Is it like a C-section that I would have to book a date?
Yes, typically we schedule a day and we ask that you come early in the morning so that you can be assessed and we can kind of get everything together so that we can start the induction process as early as possible. So depending on when you and the physician see fit, there are different options as to what can be done to induce labor. Sometimes the physician will use a prostaglandin gel. Once this gel is inserted into the vagina, it helps to soften the cervix and promote contractions. Once this is given, you're able to continue to be mobile, either walking around, using a birthing ball, that sort of thing. But the gel itself can cause some mild discomfort or cramping sensation, sometimes followed with a nausea or diarrhea. It's not super common, but it can happen. Other times, the physician will use Cervidil, and that's also a type of prostaglandin that is inserted into the vagina, and it releases prostaglandin at the cervix and can remain in for up to 12 hours. So this one is actually removed. And it has the same effects, however, it's less invasive because it only goes in once rather than having to be gelled more than once.
That's great that I can still walk around and not be in too much pain. Is it just one dose of gel? And how long does it take from getting the gel to being inactive?
It all depends on how the first dose takes. Some women can be gelled up to 3 times, but each dose must be 6 hours apart. Again, that's why we like for you to come in the morning. That way, after the assessment, if the physician and yourself are okay with going ahead with the gel, we can get that started right away and try and soften the cervix and get some contractions going. But it can take a while. Especially if it is your first baby, things start to move a little bit slower. Aside from the gel or after administration of the gel, there are different options to pick from to continue to try and induce your labor. If the cervix is softening and the doctor sees fit, they can choose to break your water in hopes that this helps with the process of labor. Another option is a balloon catheter. So it will go in your vagina and the balloon itself would sit at the cervix. This helps to put pressure in that area and it would then cause dilation of the cervix to help kind of bring that along. The third option is an oxytocin drip, and this is administered through an IV. The oxytocin works similar to the gel by causing the uterus to contract. However, it does have a stronger effect and it helps our body to go into active labor the fastest.
This all sounds great. What are the risks or side effects of these types of induction options?
With any interventions comes risk. However, the risks associated with induction of labor tend to be minimal due to the amount of monitoring by our nurses. Breaking the water is done with the little amnio hook. It's a little bit invasive, but it usually doesn't cause any pain. With this, it can put you and the baby at a greater risk for infection. Much like the gel, anything that's being placed into the vagina increases the risk of infection. Therefore, the option of the catheter balloon also poses a risk for infection the longer that it is left in. The oxytocin also has a higher risk for C-sections due to the uterus potentially being overstimulated, causing the baby to be at risk for oxygen depression. However, oxytocin is able to be stopped or the dose can be decreased once active labor is reached, or if you or baby are in distress. Throughout the oxytocin drip, you'll be closely monitored, therefore you're not really allowed to get up and walk around as freely as you would with the balloon catheter or with the gel. Of all of these 4 options, the gel, balloon catheter, and rupturing of the membranes do have the lowest risk for potential harm to the mom and baby. However, because of the almost consistent and constant monitoring with oxytocin drips, the benefits definitely outweigh the risks.
It really is a lot of information, but I feel better knowing I have options and I'm able to understand them. I really appreciate you taking the time to go over this with me. I really don't think I want to have a C-section, but I'm still unsure if I would want to be induced either.
If you're sure that you are not wanting a C-section, we can definitely cancel it and hope that you are able to go into labor on your own. However, if this doesn't happen, there are many risks associated with having the baby stay in too long, like I mentioned earlier. Once we talk with your physician, we can schedule a date for the induction if you're comfortable with that. And if not, we can definitely consult the physician about your other options and any other worries that you might have.
That the doctor won't be willing to do an induction. They already scheduled me for a C-section and they didn't really give me a chance to choose otherwise.
I can definitely explain to the physician how you're feeling and what we discussed today. I think it would be very beneficial to schedule another appointment with your doctor to go over what we discussed. And I can also be there if you feel as though you need me to be. At the end of the day, I want you to know that this is your decision. And if you do not want to have a scheduled C-section and would rather be induced, that is up to you. Unless something were to occur that a C-section becomes our only option. Do you have any other questions for me?
I don't think so. Not at the moment, at least.
I know this is a lot of information, so I'll give you some sheets just summarizing what we discussed today, and I'll also give you the number to the clinic. That way, if you have any more questions before your next appointment, you can call and we will go over all of this again at your next appointment with the physician, as well as when you arrive in the hospital if you do come in for an induction of labor.
Thank you so much. I'm feeling much better about the whole situation.